I remember Christmas Day, 2020, I felt pain. I called my brother-in-law. He's a medical doctor. I put him on speaker and he just told me, you are in labor. She's breathing so hard, they will give her steroids. They had to put up a CPAP, they had to put up on oxygen. But it wasn't getting better. She wasn't getting better. They told us she had BPD. And I was like, what is that?
Not a lot of people have heard of BPD, but it is the most common condition caused by prematurity. It stands for bronchopulmonary dysplasia, which basically means lung disease associated with being born early. We categorize BPD in different ways, but the most common one is by dividing it into mild, moderate, or severe categories. The amount of breathing support that babies need could be they need a nasal cannula, which are little tubes that go into the nose, or it could mean that they need a tracheostomy and is connected to a breathing machine that provides support for every breath that they take.
I felt like in an ocean, and you're not seeing anything, no land, no hill, no tree, nothing else.
Victoria was referred to Lurie Children's Hospital because she had a diagnosis of severe BPD. We're the only program for patients with severe BPD in Illinois. Babies who have the most severe lung disease, who do not get the treatment that they need, have a very high risk of dying. And so it's important for them to be referred to programs who are used to taking care of babies like this. And so she was referred here to get a tracheostomy and breathing machine that she could have at home for her to have that long-term support and thrive.
We got there and the team was waiting. I can't even count many people in that room. I came in and they were like, ah! I had these tears of joy. Like they knew what, you go somewhere and they knew what they are doing. I think that would give me that sense of relief. They knew what they were doing. This is not their first rodeo.
There are other complications that come with having severe lung disease, and one of those is developmental delays. They need therapists working with them and helping them move around and interact with the environment around them and with their parents and other family members so they can have the best outcomes possible. Victoria was referred to us on CPAP, which is usually given by little short tubes that go into the nose or by a mask. And what we noticed is that she was working very hard to breathe. And you could tell that she wanted to have normal interactions, but she was using all of her energy to try to be stable and get by. And so after she got the tracheostomy and was connected to the breathing machine, she was able to get more support. So she was able to move more and she was able to do more with therapies and interact. And she seemed to wake up and be able to do normal baby things.
It's getting easier and easier by day. She's getting so strong, super strong. She's talking. She's not supposed to be talking with the trick, but she's doing it so well. The team were just top notch. It was like I leave my family to another family. It was a gradual process, but I'm out. I'm on land. I'm under the shade, and I'm sipping my pina colada.